clavicle, head of the clavicle. This indentation right here is the jugular notch. This is going first intercostal space, second rib, second intercostal space, third rib, third intercostal space, fourth rib, fourth intercostal space, in line with the nipple, but not always accurate with women. Xiphoid process, the tip of the sternum, umbilicus from here to here is 8 sun in measurement. To the acromion process, he abducts his arm, push against my hand. You could see the deltoid coming down here, the pecs, the pectoralis major attaching. This is going to be the anterior aspect of your axilla. Border of the axilla is the serratus anterior. Posterior border would be the latissimus dorsi back here. So this is your axilla. So as he brings his arm up and in, you're going to have this deltopectoral triangle. Bring your arm out. So this is going to be where the deltoid muscle, the anterior aspect, and the pecs come together. In between, there's a little hole, a triangle here. This is going to be where you'll feel for your acromion process. Fall your fingers forward, and you may feel the coracoid process underneath your fingertips. To confirm is bring the hand adduction, push against my hand the other way. Yep, so you'll be able to feel the pecs starting to contract. Okay, relax. This is going to be where you'll have your lung 1 and lung 2 in this area. Posteriorly, we have the triceps muscle. It's that. So bend your elbow. Yep, so biceps, and then extend your elbow, triceps muscle. We can see here, this would be your humerus or your brachium. As he abducts his arm, push against my hand, you could see the deltoid coming down here to the insertion point. You can run your extensors. Medial epicondyle is going to be attaching to a flexor. So all the flexors come and attach to the medial epicondyle. If you press here and then have the patient flex their wrist, you could feel all these the tendons popping out at you. And same thing with extension. If you feel the pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. So this is kind of similar to how it would be if you could. In between are going to be the carpal bone, so you can move the hand around back and forth. What won't be moving would be your ulnar bone and your radial bone. What will be moving would be the wrist, so you'll feel these carpal bones pushing up at you. Then we have the metacarpals, which are in here, in the palm. As we go distally, we have the phalanges, proximal phalange, distal phalange, and each of these other fingers we have a proximal, middle, and distal. These are going to create a proximal interphalangeal joint, middle interphalangeal joint, distal interphalangeal joint. The thumb and the toe only have a proximal interphalangeal joint and a distal, proximal to distal. So scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, lunate, hamate. The upper trapezius, as we pinch along this area, going down inferiorly, we have the medial border of the scapula, inferior angle of the scapula, lateral border of the scapula. Following back up superiorly, we have this superior angle. In between, we have the spine of the scapula. This turns into the acromion process. This spine of the scapula, it's easier if you either roll your fingers back and forth or pinch it so that you're able to feel in between. This is going to be in line with T3. Spinous process, the root of the spine of the scapula in line with T3. The superior angle, if you go across, is going to be in line with T2. And remember that the spinous processes are going to be lined inferiorly overlapping one another. So the spaces in between are going to be larger in distance rather than close together when you feel the cervical spine. Bring your arm behind your back. Another way that you could do it is trying to accentuate the medial border, your inferior angle, and then the lateral border. Here you could see the posterior aspect of the deltoid muscle, triceps muscle, and then the forearm. Above the spine of the scapula is going to be your supraspinous fossa, where the supraspinatus muscle sits. Inferior to the spine of the scapula, we have the infraspinous fossa, where the infraspinatus muscle sits. Lateral to it, we're going to have underneath the spine, the scapula is going to be your subscapularis. We can't really target it too much, but in this area we have the latissimus dorsi as well as the teres major and the teres minor. Remember that the sits muscle, the rotator cuff group, includes the supraspinatus, infraspinatus, teres minor, and subscapularis. These three muscles, supraspinatus, infraspinatus, and teres minor, attach to the greater tubercle on the humerus. The subscapularis attaches to the lesser tubercle.